Patient asking for LAMA, the medical team has concern about the mental capacity of patient. What decisions should be made? Option A, call the police. Option B, call security. Option C, let the patient go. Option D, encourages the patient to wait by telling the need for treatment. Correct answer is encourage the patient to wait by telling the need for the treatment. Even after knowing the need for the treatment, patient doesn't want to stay at the hospital, then you cannot do anything except letting the patient go. But before that, you have to encourage the patient to wait in the hospital by explaining all the need for the treatment. Which of the following drugs will require 2 nurses to check during preparation and administration? Option A, oral antibiotics. Option B, glycerin suppositories. Option C, morphine tablet. Option D, oxygen. Answer is a C, morphine tablet. So as a morphine tablet is a CD drug, so the CD drugs should be checked by the 2 nurses during the preparation and the administration. Which bag do you place infected linen? Option A, water-soluble alginate polythene bag before being placed in the appropriate linen bag, no more than 3/4 full. Option B, orange waste bag before being placed in the appropriate linen bag, no more than 3/4 full. Option C, white linen bag after sorting, no more than 3/4 full. Correct answer is A, water-soluble alginate polythene bag before being placed in the appropriate linen bag, no more than 3/4 full. A nurse is having trouble with doing care plans. Her team members are already noticing this problem and are worried of the consequences this may bring to the quality of nursing care delivered. This problem is already brought to the attention of nurse. The nurse should, option A, accept her weakness and take this challenge as an opportunity to improve her skill by requesting lecture from her manager. Option B, ignore the criticism as this is a case of team issue. Option C, continue delivering care as this will not affect the quality of care you are rendering your patient. Answer is A, accept her weakness and take this challenge as an opportunity to improve her skills by requesting lecture from her manager. If someone collapses while queuing or falling in line, what must be assessed first? Option A, call a code. Option B, check for responsiveness. Option C, check if the scene is safe. Correct answer is C, check if the scene is safe. What is the purpose of clamping a chest tube? Option A, to prevent further lung collapse and entry of air. Option B, to minimize the feeling of pain on drain insertion. Option C, to aid the drain into the correct position. Option D, to minimize the risk of infection. Answer is A, to prevent further lung collapse and entry of air. In a community hospital, an elderly man approaches you and tells you that his neighbor has been stealing his money, saying sometimes I give him money to buy groceries, but he did not buy groceries and he kept the money. What is your best course of action for this? Option A, raise a safeguarding alert. Option B, just listen but don't do anything. Option C, ignore the old man, he is just having delusion. Option D, refer the old man to the community clergy who is giving him spiritual support. As this is a safeguarding issue, you have to raise the safeguarding alert, so answer is A. When will you consider giving out information of the patient to a police officer? Option A, if he has a rank of inspector. Option B, if the safety of the public is at risk. So the correct answer is B, if the safety of the public is at risk. What could be the reason why you instruct your patient to retain on its original container and discard nitroglycerin medication after 8 weeks? Option A. Removing from its darkened container exposes the medicine to the light and its potency will decrease after 8 weeks. Option B. It will have a greater concentration after 8 weeks. Answer is A. Removing from its darkened container exposes the medicine to the light and its potency will decrease after 8 weeks. You have assigned a new student to an experienced healthcare assistant to gain some knowledge in delivering patient care. The student nurse tells you that the SCA has pushed the client back to the chair when she was trying to stand up. What is your action? Option A. Suspend SCA immediately. Option B. Intervene on the spot and raise concern immediately to the manager on duty. Option C. Ask the client later on what has happened. Option D. Ignore the student as she is new and does not have any experience. Answer is B. Intervene on the spot and raise concern immediately to the manager on duty. A newly admitted client refusing to hand over his own medications, and this include controlled drugs. What is your action? Option A. You have to take it anyway and document it. Option B. Call the doctor and inform about the situation. Option C. Document this refusal as this medication are his properties and should not do anything without his consent. Option D. Refuse the admission as this is against the policy. Correct answer is C. Document this refusal as these medications are his properties and should not do anything without his consent. What is the best way to prevent a patient who is receiving an enteral feeding from aspirating? Option A. Lie them flat. Option B. Sit them at least at 45-degree angle. Option C. Tell them to lie on their side. Option D. Check their oxygen saturations. Correct answer is B. Sit them at least at 45-degree angle to prevent the patient from aspirating. Which check do you need to carry on before setting up an enteral feed via nasogastric tube? Option A. That when flushed with the red juice and the red juice can be seen when the tube is aspirated. Option B. That air cannot be heard rushing into the lung by doing the whoosh test. That the pH of gastric aspirate is less than 5.5 and the measurement on the NG tube is the same length as a time insertion. Option D. That pH of gastric aspirate is more than 6 and the measurement on the NG tube is the same length as the time insertion. Correct answer is C. That the pH of gastric aspirate is less than 5.5 and the measurement on the NG tube is the same length as the time insertion. You are mentoring a third-year student nurse. The student nurse requests that she wants to assist a procedure with the tissue viability nurse. How can you deal with this situation? Option A. Tell her it is not possible. Option B. Tell her it is possible if you provide direct supervision. Option C. Call to the college and ask whether it is possible for a third-year student to assist the procedure. Option D. Allow her as this is a part of her learning. Correct answer is B. Tell her it is possible if you provide direct supervision. When doing your drug round at midday, you have noticed one of your patients coughing more frequently whilst being assisted by a nursing student at mealtime. What is your initial action at this situation? Option A. Tell the student to feed the patient slowly to help stop coughing. Option B. Ask the student to completely stop feeding. Option C. Ask a student to allow patient some sip of water to stop coughing. Option D. Ask the student to stop feeding and assess patient swallowing. Correct answer is D. Ask the student to stop feeding and assess the patient swallowing. What is the purpose of nil per oral after surgery? Option A. To prevent a blood clot. Option B. To prevent aspiration. Option C. To facilitate respiration. Option D. To prevent embolism. Answer is B, to prevent aspiration. A patient underwent an abdominal surgery and will be unable to meet nutritional needs through oral intake. A patient was placed on enteral feeding. How would you position the patient when feeding is being administered? Option A, sitting upright at 30 to 45 degree. Option B, sitting upright at 60 to 75 degree. Option C, sitting upright at 45 to 60 degree. Option D, sitting upright at 75 to 90 degree. Correct answer is C, sitting upright at 45 to 60 degree. An unmarried young female admitted with ectopic pregnancy with her friend to hospital with complaint of abdominal pain. Her friend assisted a procedure and became aware of her pregnancy, and when the family arrives to hospital, she reveals the truth. The family reacts negatively. What could the nurse have done to protect the confidentiality of patient information? Option A, should tell the family that they don't have any right to know the patient information. Option B, that the friend was mistaken and the doctor will confirm the patient condition. Option C, should insist friend on confidentiality. Option D, should have asked another staff nurse to be chaperone while assisting procedure. Correct answer is D, should have asked another staff nurse to be a chaperone while assisting a procedure. When do we need to document? Option A, as soon as possible after an event has happened, to provide current up-to-date information about the care and condition of the patient or client. Option B, every hour. Option C, when there are significant changes to the patient condition. Option D, at the end of shift. Answer is A, as soon as possible after an event has happened, to provide current, up-to-date information about the care and condition of the patient or client. An elderly client with dementia is cared by his daughter. The daughter locks him in a room to keep him safe when she goes out to work and not considering any other option. As a nurse, what is your action? Option A, explain this is a restraint. Urgently call for a safeguarding and arrange a multidisciplinary team conference. Option B, do not think this is the best way of keeping him safe. Option C, call police, social services to remove client immediately and refer to safeguarding. Option D, explain this is a restraint and discuss other option. The correct answer is A, explain this is a restraint, urgently call for a safeguarding and arrange a multidisciplinary team conference. Thank you for watching. Please like my video and please consider subscribing to my channel and press the bell icon to get more video. Keep watching, keep supporting. Thank you.